I'll start by introducing myself. My name is Dr. Longoria. I actually like to be called Rudy. That's fine by me. I don't like the title doctor that much. Nurses and people here who I work with just call me Rudy, and that's fine by me.
They gotta respect you, though.
They do.
All right.
They do. They're very nice to me. If not, I'm not a pushover either. You know?
They tend to.
Yeah, they sometimes do, especially some other doctors. They try and be bullies. But I don't allow that. You can't. You can't allow that. But anyhow, yeah, I'm from Brownsville. Okay. I studied here in Brownsville, and always liked school, and at an early age I knew that I wanted to be a doctor. Actually, when I was 5 years of age, I have a picture at home with a whole letter saying what I want to do when I grow up, and it says, I'm going to be a doctor. And it has a picture of me, and my mom has it. Anyhow, so I go to school, and I go to school with a gentleman that's right here, Mr. Gus Solis. He was my teacher in high school, and I remember he was one of the first people that I told while I was in high school that I was going to be a doctor. I must have been like 16 at the time. And I told him, you know what, I'm going to be a doctor when I finish high school. So I went to college, did everything that I had to. It wasn't easy, a lot harder than I thought it would be. And which was good, because it makes people humble. So once I finished medical school and I got into residency, I had several options. I thought I was going to be a surgeon, so I started a surgery residency in New York. And a few months into it, I hated surgery. The lifestyle was bad. All the doctors and residents that I worked with, if they weren't married, they had been divorced several times. All of them smoked cigarettes. And you found it? Yeah, let's hope it works. Anyway, all of them smoked cigarettes. They had the worst diet ever. And they were not nice people. So I found out that that was not for me. I was in the hospital at least 36 hours, go home, sleep for 4 or 5 hours, come back. Same deal, every day, every day. And then that's when I really thought that I should just do something where I have more patient contact and I get to see all types of patients. So that's why I became an emergency room physician, because I get to see neonates, which are 3-4-day-old babies. I get to see everything in between: gynecology, internal medicine, ophthalmology, a little bit of surgery, geriatrics. I see everything, and that's a lot of fun for me. That's a lot of fun. So it seems like we got this working, which is great. So our talk today is going to be on heart attacks, ataque al corazón. That's how you say it in Spanish. Okay? And it's a very broad general topic. So I'm going to try and make this as simple and as general as possible, but still try and get the idea across of what to expect and what to do with chest pain and the possibility of having a heart attack. Okay? So here we go. I'm going to start with a little pop quiz or a little test, un pequeño examen. All right? So hopefully you all can read it, and if not, I'll read the question. So what to do when you have some type of chest pain? When do you actually go to the ER? Do you go when you feel like you have to sign the Obamacare, or shoot, I got to sign some insurance forms? You have some ringing of the ears. You have an uncomfortable squeezing pain on the chest, or numbness of the feet. The obvious answer is, something's not right. Something's going on with my chest. Whether it's heartburn that you've never experienced before, whether it's something very heavy like an elephant or something very small but you still feel it, something small like a mouse. Like I feel like I have a little mouse on top of me, something's not right. So that's when you want to go to the ER. You know, 6 quick questions. If you were having uncomfortable chest pain all day, you shouldn't worry about it, right? You should wait until you have shortness of breath and start feeling tired. And go to the nearest clinic or your doctor once you start having this shortness of breath or you start feeling tired and the chest pain still is there. Is that good advice or bad advice? That's probably bad advice, right? I mean, if you start having chest pain out of nowhere, you're watching TV, you're eating breakfast, you know, whatever it is that you're doing, it's probably best to go to the ER. Really, with my personal experience, I've been surprised a lot of the times. I don't take any chances. If someone tells me they're having stomach pain, I do an EKG. If someone tells me that they're having a headache, I do an EKG. I generally do chest x-rays as well. I don't want to miss something on a patient with a test that's easy to do, like an EKG, and you can get one of those almost everywhere nowadays. You know, they're not, as long as there's someone who's been reading EKGs for a little while, they should not be that difficult. Okay, here's another question. So, heart attacks do not present with symptoms of discomfort in other parts like the arms, back, neck, or stomach. Is this a true or false question? That's totally a false question. You know, heart attacks present with a lot of different symptoms, not just chest pain. This is 4 out of 6, sorry. Okay, when is shortness of breath a warning sign of a heart attack? You know, if you're out experiencing a beautiful scene of nature and you feel short of breath because it's so beautiful, that's probably not a warning sign of a heart attack. If you're at a party where people are smoking and you feel short of breath, you know, that's probably not a sign of a heart attack. Okay, what about the shortness of breath is also associated with chest pain? That's probably true. You're not feeling anything new. You're not feeling anything except new onset shortness of breath. That could also be an indicator for cardiovascular disease, angina, chest pain, all those things. So I would have to say that answer E is the correct answer here. You know, the shortness of breath is also associated with chest pain. You're not feeling anything except new onset shortness of breath. So even just a symptom like shortness of breath can indicate that there's a problem with the heart. Okay, if for no reason at all, you just can't catch your breath, it's not a bad idea to think about heart attacks. Okay? If you have any questions while we're doing this, you can ask. Okay. All these are warning signs of heart attack except cold sweats, nausea, hunger or cravings for food, lightheadedness. C, yeah, that's not really a typical sign of a heart attack.
They're not side effects of new medication, are they, doctor?
Hunger or cravings of food, not really. You know, we do put some people on medication. On what? The hunger or craving? Hunger or cravings of food?
After medication.
Well, okay. Here's another question. If you are experiencing any of the signs of a heart attack, like chest pain, nausea, lightheadedness, shortness of breath, or pain in the neck or shoulder area, what is the fastest way to begin life-saving treatment?
Either you drive if you can, or you call the ER right away.
Probably call 911. Don't call anybody for advice. It's better not to drive yourself. You never know. It could get worse on the way over there and you can have an accident. And sometimes if you ask a friend or a family member, they're too excited driving to the ER that something could happen on the way, an accident. So it's not, if you're really experiencing some discomfort, just call 911. So that's the pop quiz. And these are the topics that we're going to touch on heart attack. All right? General things about heart attacks, the warning signs, the risks of having a heart attack, symptoms and diagnosis, and the treatment of heart attack. Okay, about heart attack. Just a general idea. I want everybody to know that a heart attack is also called a myocardial infarction. It's the same thing. Okay, people might confuse it with something else. They might think, what is an MI? Is it the same thing as a heart attack? It is. I put there something known as cardiovascular disease. Cardiovascular disease, I want you all to know that does pertain to, generally, to...
Dietary, please call extension 25803. Dietary 25803.
Cardiovascular disease pertains to both problems in the brain and in the heart. Okay? Cardiovascular disease is now the most common cause of death in the world. Okay? In higher income countries like ours, it does take 40% of the people do suffer death from cardiovascular disease, whether it's a heart attack or a stroke. All right? And what I find interesting is that before 1900, cardiovascular disease was not the #1 killer. It was more than anything infectious diseases and malnutrition. But now, you know, everybody's well fed. There's enough, well, not everybody, but there's a lot of means into getting food, and people are now suffering from cardiovascular disease a lot more than from infectious disease, especially since we have a lot of antibiotics. What I found interesting is this fact. A lot of this stuff I got from the American Heart Association, is that every 34 seconds, a person in the United States has a heart attack. That's almost 2 people every minute are having a heart attack. So we should know something about it, at least the basics. All right? Again, if you all have any questions, you all can stop me at any time. I know this slide seems like it has a lot, but I'm going to try and access a video after this, see if we can do it. Now, this is a general idea. The heart is a muscle. It needs oxygen. It needs nutrients, just like everything else in the body. All right? And the most common cause of heart attacks is something known as atherosclerosis, atherosclerotic disease, atherosclerosis, same word. Now, atherosclerotic disease is when we have the accumulation of fat, triglycerides, cholesterol in the blood vessels. And as it starts to accumulate, it narrows the blood vessel, thus preventing the nice flow of blood and thus oxygen and nutrients to important muscles like the heart. So atherosclerotic disease can also be known as the silent killer. All right? So if you ever hear the term, yes, sir, you have atherosclerotic disease, or you're suffering from atherosclerosis, now you know. All it is fat, which is being deposited in a blood vessel. That's it. And it's a silent killer because it slowly, slowly, slowly narrows the arteries. Did you have a question?
How would you say it in Spanish?
Atherosclerosis. Atherosclerosis.
Doctor,
Yeah.
but you know, the big point here is how the people get in that shape.
Yes.
I can talk about it, and he can talk too. You go to the mall and walk, and you see people who don't walk, don't watch their diet.
No.
And you can see why they get heart attack, high blood pressure, and everything else.
No.
I had a doctor, Dr. Warnell, you probably don't know me, he moved to Westbrook. I'll never forget 35 years ago when I was having problems, he told me what I had to do. He told me plain English, you start walking, and I don't want 2 days a week, I want 7 days a week. And you go to the mall, you see people, they're so big, and they eat all kinds of stuff, you know. They don't, watch themselves.
I totally agree. And that's all you need to do, really. You have to force those muscles to work for a little bit of energy, you know? And the more you force them, the more energy that your body requires, the higher your metabolism gets, the higher the metabolism you have, the easier it is for it to use all that fat that we eat. I mean, if we do have a fatty meal, you know, you do need exercise, definitely, and diet. And we'll touch on exercise and diet a little bit more, but that is today's problem. I mean, we work a lot. Go ahead.
Is there a way to reverse that? Is that what you mean by diet exercise? Or is there some-
Now, unfortunately, no. Once atherosclerotic disease is there, once those plaques of cholesterol or fat are there is no way to reverse that, unfortunately. Once it's there, and you know, you can exercise, you can diet, and let's hope that it doesn't keep accumulating in the blood vessel and thus narrowing the blood vessel, causing that heart attack. But once it forms, it never really leaves.
So your lack of a good diet and lack of good exercise accumulates over the years.
Over the years.
To cause that. That's why the younger people now, because of lack of exercise and lack of proper diet, it's taking them shorter periods of time to get to the same.
Yeah, there's
same percentage of blockage as we do as older people.
Yeah, and the heart starts to be covered with fat. I remember when I was in residency, we did an autopsy on a 10-year-old kid. The kid had died in an accident. He was only 10 years old. So it was a learning institution. We go to the autopsies. All the residents, if there's an autopsy, you have to go. You have to be there. You have to learn how to open a body. You have to learn the organs and all that stuff. And this was a 10-year-old fat little kid, real big kid. And the funny thing was that there was a lot of fat around the heart, and he was only 10 years old. 10 years old. So it's like you said, we have to take care of our diet and our body by exercising. We do. There's just too much, I guess. It comes too easy to us, food nowadays. So, go ahead.
It starts with the family, you know what I mean?
Yeah.
The mother, the father, it starts with them. Their kids and certain meals.
And sometimes we end up in a cycle too, where all we do is work, or mom and dad are just working to pay the bills. And sometimes it's just, I guess, easier for these parents to bring home a pizza, bring home some McDonald's. Here it is. It's a lot faster than me getting home and cooking a meal or something. And then the kids, well, they love it, you know. And before you know it, the kids are, 12, 13, 14, and they can't even run a mile. When before in school, running a mile was something to be proud of. I ran a mile. I ran 2 miles in school today. And that was part of kinesiology, of, what is it, PE?
Physical education.
Physical education. Back in the day, if you ran 2 miles under 20 minutes, at least here in the US, that was passing. If you didn't, you didn't pass. I don't think they do that anymore. No. 2 miles is a lot under 20 minutes for an 8, 9-year-old. And we used to do it when we were kids. Anyway, one important thing about atherosclerotic disease is that it starts to accumulate. And when it gets nice and hard under that blood vessel, it forms what we call a plaque, something hard. And because it's hard, it makes the blood vessel very fragile. So the blood vessel from the inside breaks, and when it breaks, the cholesterol, the fat, spills out into the blood vessel, and a clot also starts to form, thus reducing the blood flow, and that's what actually causes the heart attack. So atherosclerotic disease, atherosclerosis, goes into a plaque, which is just hardened fat, which then breaks, makes a clot, and causes a heart attack. I hope I didn't lose anybody. I just want you all to have a general idea of what happens with heart attacks. Okay? So this is what I was trying to get at with atherosclerotic disease. So there we have a heart. And if you notice, the heart is surrounded by some arteries. And let's magnify it, and let's have this artery right there. It's nice and clean, all right? We have the inner layer, we have the middle layer, and then the outer layer. In between the inner and the middle layer is where atherosclerosis starts to form. And that's all it is. That's what I was trying to get at with that wordy slide that I had previously. So you have atherosclerosis forming. You know, we don't take care of ourselves. We're stressed. We're always working. We go out with the buddies and drink, smoke, have fun, go to work, not exercise. Atherosclerosis disease keeps growing, and it forms that hardened plaque. So we have that plaque, right? You know, we've been stressed out. The plaque grows. Now it makes that vessel very unstable, you know, very, very fragile. And think about the physics of this. Whenever you have a reduced area, like in this area, blood flow is going to be a little bit faster. So the blood flow comes, and then it gets, you know, it goes into a smaller area, and the smaller area, it causes for turbulence at this point. Yeah. The turbulence then breaks that plaque. The plaque breaks. And once the plaque breaks, all that fat comes out, the cholesterol comes out, those triglycerides come out, and it starts to block the blood vessel. And not only block the blood vessel even more, but it starts to make a thrombus, a blood clot. Because the natural thing for the body to do is to clot any little injury we have. So a clot forms. So we not only have fat now obstructing the nice passage, the nice flow of blood, but we also have a clot. The clot forms. It gets bigger. It gets bigger until it blocks the whole artery, the whole blood vessel. And that's what causes a heart attack. Yep. So now we know the general and basic idea of why heart attacks happen, because of atherosclerosis. Go ahead.
What causes the clot to grow as opposed to breaking off?
Okay. The thing is, the body senses the plaque as something foreign. And it's constantly stimulating the blood vessel to form a clot. Because it's not part of the blood vessel, it's something foreign to the blood vessel. The clot will never form and then stop, and that's it. Once it starts to form, it slowly gets bigger and bigger and bigger because the plaque itself is not recognized by your body. So clotting factors go there, and then they think that the artery broke. It tore. So it's trying, your body's trying to protect itself against a broken or a torn artery. So what it does is that it forms a clot. And then the plaque continues to stimulate more clotting factors to aggravate the body, so more and more clotting occurs. Yeah, more and more clotting occurs. And that's basically what happens.
How long a period of time?
It's pretty fast. Yeah, it's fast.
Once it breaks off,
You probably have an hour before you get that MI. You probably have at most an hour. Go ahead.
In the case of blockage in the carotid arteries, can't they actually clean those out, or do they have to open them and then clean them?
They have to open them and clean them out. And the reason they can do that with those is because those are big arteries. These are just too small for our technology nowadays. You know, we have stuff that goes in there and opens them up, but actually clean out the cholesterol plaque, the atherosclerosis, We don't have that yet.
Doctor?
Yes.
Just like in drain, you know, I have rental houses and you put drain in there and that breaks up whatever's in there and it just goes right through. But it cannot be done this way.
No. I mean, well, there's medication that we have that causes thrombolysis. In other words, thrombo meaning clot, lysis means break.
Okay.
So we have medication that does thrombolysis that we inject, and it works 94% of the time. Once it's injected and it reaches that clot, it works to break that clot out.
Yes.
You know, 6% of the time, it doesn't work. It actually makes things worse. Yeah. But, we do have those type of medicines.
Once you give it, how long before it starts working?
Immediately. Immediately. People start getting better 10, 15 minutes. Go ahead, sir.
Once a clot starts, is it inevitable that it will grow and block?
Yes, it's inevitable. Once it starts, there's nothing stopping it. There's nothing stopping it.
Jeez.
Yeah.
So what does a person feel or you don't, actually?
Initially, you won't feel it.
Yeah.
But once the lumen of the artery starts to get smaller and smaller, then that's when you start having that discomfort, heaviness,
Yeah.
Sure.
that shortness of breath. Some people even get lightheaded,
You're not getting enough blood.
cold sweats. Yeah. Because, it is the heart that we're talking about. It is an artery that feeds the heart, that helps the heart pump. It feeds the heart with oxygen and nutrients that it needs. And if the heart is not receiving it because we have a blocked artery, then that's when you're going to start experiencing that chest pain, that lightheadedness.
That's when you should know that something is wrong.
Yeah, something's wrong. That's when, you call 911. You don't go, or that's when you don't start feeling the Obamacare papers. That's you go straight to the hospital. So let's continue. I think that was it for that. See, that's why I wanted to use this
Doctor,
slideshow.
the veins were different sizes?
Generally, yes.
See?
Yeah, generally veins are a little bit bigger and not as strong as arteries.
Okay, you're not getting mixed up. So some are called arteries and the others are veins.
Yes, sir. Now arteries are what take nutrients, including oxygen, to those muscles and to those organs, and the waste products are brought back by veins. So they pick up some oxygen over at the lungs, and then the arteries take the oxygen over to the rest of the body, including the brain. And then when that blood is oxygen depleted, it comes back, but through veins, not through arteries. It's just a terminology. Okay? So that's why I had all this wording. I want people to understand a little bit more than just heart attack. I want them to be educated, to know what atherosclerosis is. It'll help you take care of yourself in the future.
Is there a way to measure your degree of...
Definitely. Of blockage?
Yeah, blockage.
Yes, there is. And we'll talk about it a little bit later, and I'll point it out to you when we're there.
Sure.
Now, once a heart attack happens, can you recover? Absolutely, as long as you get the treatment. Okay? And how long will it take that heart to recover? About 8 weeks, 8 to 12 weeks, but on average, 8 weeks. So, in other words, your heart muscle is actually a very strong muscle. What makes it a strong muscle is that it's full of arteries giving it nutrients and oxygen. So that's why it can, for the most part, almost fully recover. It does take some time, but there is good news. It recovers, right? You can go back to work if you ever suffer a heart attack. You can go back to doing the things you want to do and live a normal life. for the most part. Okay? I just wanted to bring that point up, that your heart does recover even after a heart attack. It takes a little bit of time. It takes some tender, loving care on your part and on your family's part, but it can be done. Okay? Okay, I don't know if you guys have heard the term angina. What is angina? Chest pain. That's all it is. You know, it's a fancy name for chest pain. I'll go into a little bit of details as far as what is angina, but you can say, I have chest pain, or I have angina.
That's heartburn.
Somewhat like heartburn. You feel something uncomfortable on your chest around the entrance to your stomach, the epigastric area. That is angina. It's not a heart attack. Let's make that clear. Angina is not a heart attack. It's chest pain. Now, why do we get chest pain? Why do we get shortness of breath? Why do we get lightheadedness and not a heart attack? Because we're getting angina. And all angina is diminished blood flow and thus diminished oxygen to the heart, right? Because we have an atherosclerotic plaque there that's closing down or blocking that artery and thus reducing the amount of blood, oxygen, and nutrients to the heart muscle. You know, the plaque at this point has not torn, has not broken, and thus hasn't formed a clot. But it's reducing blood flow and thus causing angina, which is basically the symptoms, chest pain, shortness of breath, and all that, which can occur at any time, especially if you're exercising or doing something very stressful. Angina can recur several times. It doesn't just happen once. Because remember, once you have a plaque, it never goes away. Right? Once you have a plaque there, it never goes away. So once you have angina, you'll probably always keep having angina. You all with me?
So there's no pill that can go through the vein or artery to destroy that blood?
No, sir. There isn't. Yeah, I wish I could say something else, but unfortunately, no. All right. So now we know what angina is, right? It's chest pain. Good. Now we know what atherosclerosis is. Now we know what angina is. Now we know what a plaque is. Same thing as atherosclerosis, but just a little bit harder. Yes, ma'am.
I'm a little confused. That medication that you said about the injection, and then you say there's...
Oh, yes. But
what does the medication at warfarin work?
Warfarin? Okay. Warfarin is a blood thinner. It's a very powerful blood thinner. Okay? And warfarin prevents further formation of a clot by inhibiting clotting factors. But it doesn't destroy a clot that is already there.
So it's like delaying the clot?
It's delaying, yes, the progression of a larger clot. I mean, warfarin is a very special medication used only on certain people. Not everybody gets warfarin. And it's a very strong blood thinner. And we use it to prevent further clot formation. But will it remove it?
No.
Absolutely not. Yeah. Okay. Yes, ma'am.
What good is Crestor and Lipitor?
Crestor and Lipitor. Okay, where are we? Okay, I'm not going to be able to get to that. Okay, basically Crestor and Lipitor help prevent further formation of fat under the arteries. That's all that Crestor, Lipitor atorvastatin, all those things do. They prevent the formation of, further formation of atherosclerosis. They don't take it away. If it's there, it's going to be there forever, but they don't allow it. They help not make it bigger. I'm trying to make it as simple as possible. They help atherosclerosis not grow, and thus not form a plaque, and thus not break and make a clot that can cause a heart attack.
So that's your cholesterol medication.
That's your cholesterol medication. Yeah.
Sir, wasn't there a study on Lipitor that it causes diabetes? I'm not totally sure on that, but I can tell you this: it's not true. I know there was a study out there. I don't remember how it worked. There's different types of studies, but it's not true. No. Diabetes is caused by a bad diet, no activity, and by bad genes, unfortunately. Bad.
So cholesterol medication, sometimes they prescribe it to a patient, and they go for a while, and maybe the patient starts exercising and diet.
And it'll prevent
those from getting
further growth of the atherosclerosis, of the plaque.
So if a person develops a healthier lifestyle, later on they take them off the cholesterol medication. Because
That's good, because you reached a point where you're controlling your own cholesterol because you're exercising, you're having a better diet, high in fiber.
so it's that excess cholesterol is what's building up in here.
Yeah, so Crestor and all of these products prevent excess formation of cholesterol in the arteries. Does it remove it? No. That's it. All right, let's move on before it gets too late. Some warning signs. Everybody knows, but I just felt like I had to put them up there nonetheless. That's chest pain. You can get arm or back discomfort. Some people don't think about this, but you can get neck or jaw discomfort.
I didn't think that.
Yeah.
That could be the cause.
Trouble breathing. Some people feel lightheaded, or they break in a cold sweat, or they feel sick or discomfort in the stomach area. These are just some warning signs that, you know what? You're either experiencing angina or you're having a full-blown heart attack. You're having a bad atherosclerosis plaque in there. It's giving you trouble. And actually, we've seen these signs in the ER. We've seen all of them. I've had people come in and tell me, you know what, I've been short of breath for 5 days. And right away, a light bulb turns on, and I think, well, let's hope this lady isn't suffering a heart attack. And I would say that more than half the time, if they've been short of breath to the point that makes them go to the hospital and not to their doctor, more than half the time they had suffered a heart attack a few days back. And we can tell by doing EKGs, blood work, chest x-rays, we can tell that they had a heart attack.
But lay people, doctor, feeling bad in the arm and chest and the back and so forth, they don't think it's a heart attack.
Most people don't. Most people don't. But I mean, that's what this is. We're going to try and educate ourselves, and that's why you're here. If you know you haven't been taking care of yourself, that you've only taken care of yourself the last 5 years, but prior to that, you were a party animal. You like to, drink, smoke. You were always working. You were stressed. You didn't get enough sleep, and suddenly, out of nowhere, you start having a cold sweat. You feel dizzy, and you feel some discomfort in your belly. It's good to think that something might be wrong with your heart, and it's good to have it checked out as soon as possible. Preferably, if it's this bad, in an ER where you can actually get the appropriate treatment. Both ERs in Brownsville have access to good medical heart attack treatment. So any of the both hospitals is good enough. Now, I put this up because most people think that heart attacks mostly pertains to men. In reality, it's the, look at what it says here. Heart disease is the #1 killer of women. It's not breast cancer. It's not lung cancer. It's not uterine cancer or ovarian cancer. It's actually heart disease, the #1 killer of women in the US. It says causing 1 in 3 deaths each year. That's approximately 1 woman every minute. That's a lot of women. That's a lot of women. And women think, oh, I had the flu. I think I had the flu like 4 days ago. I was short of breath. I couldn't catch my breath. I needed to use 4 pillows to sleep. No, actually, you know, if you might have suffered a heart attack. And that's why I put this up there. Yeah. Just to make a point that women are equally as in danger as men.
Equally or more so?
No, equally. Equally,
right.
Yes. Go ahead.
So can an average person figure out whether they have angina or a heart attack?
No, that's why you need to get it checked.
So if you have some angina symptoms, you just have to call 911?
Yes, because it could just be decreased blood flow because there's an atherosclerotic plaque, because there's a plaque there not allowing enough blood flow to the heart. But what if it's not? What if that plaque broke and it caused a clot, and then it caused total occlusion, not just decreased blood flow, but total occlusion causing a heart attack? So you never really know. Is it angina? Is it heart attack? You have to get it checked out eventually. So women get the same thing, you know, chest pains, sweats, feeling tired, dizzy, shortness of breath, pains and aches all over. There is something, I'm just mentioning this. I'm not going to get into this because I think it's silent heart attack symptoms. There is such a thing as a silent heart attack. You went to sleep, you woke up, and for no reason at all, you woke up really short of breath. Or you woke up so tired that all you want to do is lie in bed. And sometimes, for one reason or another, people don't realize that they just had a heart attack. And that's known as a silent heart attack. Very nonspecific symptoms. Generally, these people are usually complain of being tired. That's it. I just feel tired. I think I've been working too much. You know, I think my kids are stressing me out too much, and that's why I'm tired. You know, I didn't get enough sleep all last week because I was taking care of somebody. Or so-and-so was in the hospital, so I was in the hospital all last week, and that's why I'm probably tired. When in fact, they had a heart attack. And those are known as silent heart attacks. And they usually escape us, escape everybody. We don't detect them on time. That's all I have to say about silent heart attacks for now. Risk factors, you all know them. I just felt I had to mention them anyway. Smoking, blood pressure problems, cholesterol problems, diabetes, overweight, not being active. And then I mentioned something at the end. Metabolic syndrome. Anybody in the room, I know some of you guys have heard of metabolic syndrome. But there's a term out there known as metabolic syndrome. What is metabolic syndrome? What is it? You know? It's actually a risk factor for a heart attack. If you have metabolic syndrome, you're at a high risk of having a heart attack. What is metabolic syndrome? All right. So I'm going to try and break it down as easy as I can. It's someone who doesn't know that they're sick, but they have several risk factors. And by having these risk factors, whether it's overweight, obesity, whether it's having high blood pressure and they don't know it, whether it's having high fasting blood glucose, like a pre-diabetic or a diabetic, or having abnormal blood fats, like high triglycerides, high cholesterol, LDL cholesterol. There's good cholesterol out there, and it's known as HDL. That's why I mentioned this. So, metabolic syndrome. Metabolic syndrome is a risk in itself of having a heart attack. If you fall into metabolic syndrome, then you're at risk of having a heart attack. And what is metabolic syndrome again? Having high blood pressure, having big waist circumference, bad cholesterol, and being almost a diabetic or a diabetic. That's what metabolic syndrome is. Go ahead, sorry.
Would genetics have anything to, I know that you stress that, they always ask you,
Definitely.
Did your mother, did your father?
Yeah, you know, genetics, unfortunately, genetics has a lot to do with it. For one reason or another, some people produce more atherosclerosis plaques, cholesterol plaques, than others. That's why some people have heart attacks early age, like in 45, 47, 48, or early 50s. It's not because they didn't take care of themselves, but it's because the liver is just producing a lot of fat. Faulty gene. That's all it is.
But your parents don't pass anything like that to you.
Well, if they had it, if they had a heart attack at an early age,
If your parents had it.
yes,
Okay.
parents, then most probably something's going to happen to you around the same age, or if not 5 years, within 5 years earlier. So if your dad or mom had a heart attack around age 50, there's a high chance of you suffering something between the ages of 45 and 50. So that's why it's good to know family history. And if you know you have a bad family history, it's better to do the whole exercise and diet. You know, take care of yourself, because you want to see your kids, you want to have a good time, you want to see your grandkids, you want to have fun. You know.
Waist circumference
So,
at 40 inches around your belly.
Yeah, you know, panzón, big belly. So I had to throw this slide in, and I gave a copy of this to you guys so you all can be aware of what metabolic syndrome is and the risk that it puts you, if you have metabolic syndrome, of having a heart attack. That way when you go to the doctor, you know, well, if I'm a man and I know that my waist circumference, if I'm a 44, that's not good. And then I ask the doctor, hey doc, did you check my cholesterol? And he tells you, yeah, your triglycerides are 300. Okay, that's a little high. Okay, that's another, you know, that's another check mark for metabolic syndrome. Doc, how was my good cholesterol, the HDL? Well, that was pretty low. You were like at 25. You're not eating enough fiber nowadays, are you? You know, because HDL, good cholesterol, is increased by diet as well and by exercise. And some of the foods that help increase the HDL or the good cholesterol is stuff like fiber, you know, prunes, oatmeal, flaxseed, all those things. All those nice grains. And if you're constantly eating junk food, your glucose is constantly going to be high. And you might be a diabetic or a pre-diabetic, almost a diabetic. So if you check, there's 1, 2, 3, 4, 5 points. If you check 3 of those 5 points, then your diagnosis is metabolic syndrome. And that is an actual diagnosis that doctors charge for. So if you ever go to your doctor and you look at the details and you see, let's see what they're charging me for. Well, they're charging me because they diagnosed me with such and such thing, like I have a skin infection, fine. But then it also says metabolic syndrome. Wait, what is metabolic syndrome?
That's a risk. That means that if they diagnose me with metabolic syndrome, that puts me in a category of a high chance of having a heart attack. That's what metabolic syndrome is. And remember, it's waist circumference, triglycerides, high triglycerides, low good cholesterol, high blood pressure, high glucose, high sugars. And on the paper you have criteria for both men and women. So you kind of have a better idea of what are the cutoffs on your blood work. Okay, metabolic syndrome's good? Metabolic syndrome is good.
No, it's not, but.
Oh, okay. Well, we're getting there. We're trying. At least now we know. Hey, if my waist circumference is a 38, I'm getting close to 40. You know? It's better. It's probably time for me to go to the mall and walk. Go to the park. You know, get a bike or something. Or do, you know, get a stationary bike. While I watch my favorite TV show. 20, 30 minutes on the bike. You know, and let's start decreasing that waist circumference.
That also goes for your diet too.
Oh, yeah.
You can't just go to bicycle, then go home and stuff in your mouth.
No, you can't do that. Or you might do what I do. I buy stuff, and then I end up having clothes on top of my exercise equipment. I'm like, what is this clothes doing on top of the exercise equipment? I should be using it, not, you know.
Doctor,
Yes.
I have a vibrator, and I put it in my stomach here.
Okay.
You see, get the fat off and get that fat.
That's.
Because I know, listen.
Yes, sir.
I know because your muscles, your boxing and so forth, you've got tendons, I mean.
Yes.
When you have that fat over your tendons, yeah, it's wrong. It's wrong. You've got too much mucha grasa.
Yeah. You.
On your belly. So you gotta shake it.
You have to shake that belly out. Yeah. Yeah, that's like a old wise tale. That really isn't true. You know?
It's not good?
No.
Tell me why?
Okay, because the only way to make your muscles strong is by stressing your heart. Okay? And what I mean by that is that you have to reach, for example, when you go out, when you're on a stationary bike, you're going and you're going and you're going, and you're there 5 minutes and your heart rate is like 75. After 10 minutes, your heart rate goes up and it's like 100. 20 minutes on that bike, your heart rate's already like 145. You're making that heart work for its oxygen, for its nutrition. And by making that heart work and get strong, it's better. Yeah. By just having this move, you know, you're not doing anything to your heart. Yeah.
Oh, I'm gonna have to get rid of it. Get rid of that vibrator.
Yeah, that's not. Yeah, that doesn't work.
It looks good because your fat is gone.
Yeah.
Your fat is gone, but maybe your inside is not that good.
No. Maybe you moved some bowels around, but.
Yeah, you're right. Okay.
This guy used to be a super athlete. He knows all that.
Yeah. I think he's teasing me. I think he's teasing me.
Boxer, played football.
That's great. Did you ever actually use it?
It's plugged in right
No, I'm glad you gave me that hint. Yeah.
I think you're teasing me, though. All right. So, again, let's talk about women for a little bit. All right? Again, remember, women are equally as possible to get a heart attack as men. And the reason I put this slide up there is because after menopause, what goes down in women? Estrogen. And estrogen has been known to have a protective effect against atherosclerosis. Again, that word. Atherosclerosis means what? Fat buildup in the blood vessel. Right? So, if you're in menopause, there's another risk factor. Low levels of estrogen. And that's why once women go into menopause, they're equally at risk of having a heart attack as men because their estrogen levels are almost the same as those as in men. Because they're low. And they have no more protective effects from estrogen. Go ahead.
Taking extra estrogen without
it has its pros and its cons. Now, there are very low doses of estrogen that are prescribed to women by their gynecologists, which it's controversial. People say it's good. Some docs say it's good. Some docs say, well, you really don't need them. Personally, I don't think it's a bad idea. Okay? It can't hurt. The problem with hormones like estrogen is that it causes an increased risk for clot formation in the legs, especially if you like to travel. If you're on an airplane, if you're in a car, and you're traveling for more than 6-7 hours, and you're just sitting, reading whatever, or listening to music, or talking to your partner about whatever nice thing it is, and you're on hormones, it does increase your risk for clots. So if you're on hormones, make sure you're exercising a little.
What about if you are on a long plane trip, if you take, say, a baby aspirin before you leave home?
That's a wonderful idea. If you take a baby aspirin, and this is for everybody, if you're on, thank you for that. If you're on an airplane or a long trip, whether it's to Florida, California, the Grand Canyon, whatever, take a baby aspirin.
Yes.
As long as you're not allergic, you don't have ulcers, it won't hurt. And it's not a bad idea to buy compression hoses. They're also known as TED hoses. You find them at pharmacies. And basically what they are, they're very long socks that reach the knee or right above the knee. And what they do is that they're constantly squeezing those calf muscles. And by squeezing the calf muscle, they're constantly pushing the blood back up into the heart. And those are known and have been proven to decrease clots by 30%. That's something. It's better than nothing. And if you're on a baby aspirin as well, hey, the risk of having a clot is a lot less. Maybe like 50, 60%
I've heard
less.
of that baby aspirin big.
It works. It actually works. And it's cheap. I don't promote any particular type of aspirin out there, but if I had to go buy myself some aspirin, I'd probably go buy some Ecotrin because it's enteric coated and it has this coating around it.
Echo what?
Ecotrin. 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 Go ahead.
I've heard both. When you take a baby aspirin, which is the preferable time to take it? In the evening or in the morning?
Doesn't matter.
It doesn't matter.
It doesn't matter because the half-life of aspirin is about 6 to 7 days. So what does that mean? Once you take an aspirin, it'll start working within 30 minutes to an hour. The cheap regular white aspirins out there, or there's the one that you spend another $1.50 for.
Doctor, how can acetylsalicylic acid hurt you and the acid that the body produces to digest your food?
Well, what it is
it's
that
much worse.
the question is, why does aspirin hurt you on the long run? Is that the question?
When we have that stomach that we produce, I mean the acid that we produce naturally to process our food,
Yeah.
it's much worse.
Oh, the acid in the belly?
Yes.
It is much worse. It is.
It can eat through your throat. It can eat through the.
Yeah, it definitely is much worse, but we don't just The thing is, we don't want to add to it, because as it is, I believe the acid in the belly goes down. Okay, we're at 7.4. It goes down to like 5 times the acidity of the blood. The acid that we produce in our belly is so acidic. And then if we're going to add an aspirin that's going to add to the acidity, I mean, I hope I answered your question.
No, I understand.
Yeah.
The body measures it pretty well, and you
Yeah.
add to it. It's
And remember, one of the things that the stomach has, the stomach lining has, when I think of the stomach, for some reason, I think of a catcher's mitt. Everybody knows what a catcher's mitt is. Yeah. It's tough, you know? It's made to resist a 100-mile-per-hour baseball all day, a couple of hours. So it's a tough glove. Not all the other gloves are made that way, except that one. And that's what your stomach is. And it's constantly protecting itself from the acid that it produces to digest our food. But why add something else to it, you know, like an aspirin?
Doctor,
Yes?
I've been on 325 for about 25 years. The other ones would not work at all.
Okay.
What? No problems with it.
That's good. That's good. If you've been on it for a while and you really haven't had any symptoms, and you feel more comfortable with 325, that's okay. And to be honest with you, the recommended dosage of aspirin in someone with diagnosed heart disease is anywhere between 81 and 325, anything in between. So you can take the low dose, or you can take the higher dose.
Low dose wouldn't help me. My blood pressure kept staying high.
Kept climbing.
325, it's normal.
Good.
What's the number on the baby aspirin?
81.
81. All right.
Doctor, can you take aspirin if you're taking water?
You can, because they work at on different entities, on different things in our system. Yes, you can, but it just depends why you're on the warfarin. And it's always good to ask your doc. If you're on warfarin because you have a heart valve, but you're also known to have bad heart disease, then a doctor might want to add aspirin to the warfarin regimen. It just depends what disease you have. Yeah.
When you suffer symptoms from a heart attack, some people say chew a couple aspirin. Is that a heart attack or stroke? Or
That's
but you don't know the difference.
okay. Yes, that is true. I would keep that recommendation of chewing an aspirin if you feel you are having a heart attack. If you're having the chest pain, all these symptoms that we talked about earlier. If you're having any of these symptoms and you think to yourself, you know what? I've never felt this before. This might be a heart attack. Take an aspirin. You can take anything between 81 and 325.
Not the coated
Nothing. Oh yeah, you can take the coated
one.
ones.
You chew the coated one?
You can take them. That's not a problem. It just takes a little bit longer for it to work, but it'll work.
So the 81 is the minimum.
Yes, sir.
Okay.
Yes, sir. Yeah, we were on strokes. What I wanted to say was this. If you have a family member and you're sitting down and you feel that one of your friends, family members, out of nowhere has right-sided weakness and they can't move their arm or they can't move their leg or they're having slurred speech, they're confused. I know some people say take an aspirin. I would not recommend it until you get evaluated properly at an ER. Whatever ER. The reason is because, remember, there's 2 types of strokes. There are strokes that bleed, and there are strokes that do not bleed. 80% of strokes do not bleed. Now, let's say that your friend or whoever is having symptoms of the stroke is one of those 20%. One of those people who's having a bleeding stroke.
But a bleeding, you're talking about inside the body.
Inside the head, inside the brain.
Okay.
Because he asked about aspirin for heart attacks and aspirin for strokes.
Okay.
Now a stroke, we're talking about the brain. Now the brain can either have a brain attack, also known as a stroke. Yeah? Now the stroke itself can be a bleeder or a non-bleeder. Now 80% of strokes are non-bleeders, 20% are bleeders. Now imagine if that friend has a bleeding stroke and you gave him aspirin. It's going to thin the blood even more and make him bleed into the brain even more, causing even more damage. Not a good thing. So I would wait for strokes. I would not wait for heart attacks. And that's the basic idea. No problem. We talked about metabolic syndrome, low estrogen in women. So after menopause, women have the same risk as men of having a heart attack because of low estrogen. Low estrogen. So how do we diagnose a heart attack? If you have a family member that goes to the ER, most probably they're going to be having an EKG done. We're very good at reading these. They made me stand up in front of like 40 people every single day for 4 years and read an EKG. That was part of my residency training. So every day we had to, that was, I don't know, 5 days a week for 4 years. Made us read 2 books. So if you get to an ER, most doctors are comfortable. They're very difficult, but after a few years of training, you know what to read. So if you go to an ER, most probably you will get an EKG, and that helps a lot in diagnosing an angina or a heart attack. Now remember that angina is not a heart attack. Angina is just chest pain. It's reduced blood flow to a part of the heart. And things happen on an EKG whenever there is reduced blood flow. And things happen on an EKG when there's a full-blown heart attack. And we can tell the difference actually with an EKG. So it's very important to get checked out whenever you have a heart attack, because we should at least, when you think you're having a heart attack, because we should at least have an EKG done.
Does every doctor know how to diagnose an EKG? Or must a special doctor?
I'm going to be honest with you. You need a lot of practice. You need a lot of practice. You need to be seeing these constantly. If not, you forget. It's like everything. You know, if you haven't done calculus since high school, or algebra, or geometry, you're going to be like pi equals what? Same thing. EKG is what? Call the ER doctor, or call the cardiologist, because we're constantly seeing these things. Every patient that goes into an ER, almost every patient, will get an EKG. So we have to read them right there and then. Fast. Also, usually twice. Now, we have to correlate the EKG with 2 more things. And those 2 more things are blood testing. Really what we're looking for are cardiac markers. The reason I'm mentioning this is because I want you guys to be familiar with the terminology. I want you to be smart about things. If you go to the ER because you're having indigestion and you think, hey, this might be a heart attack, you want to ask the right questions. Hey, doc. Hey, nurse. How was my EKG? How were my cardiac markers? Don't say, how was my blood test? Ask, how were my cardiac markers? Were they elevated, correlating with a heart attack? Or were they normal,
not correlating with a heart attack. So we need to be familiar with terms such as atherosclerosis, angina, EKG, cardiac markers.
Is that a normal EKG?
No, sir, it's not. No, no. This shows what we call an inferior wall MI. The heart is composed of several walls, and one of the most common heart attacks that you find is whenever there's a heart attack at the very bottom of the heart, at the end of it. And it's showing an inferior wall MI. Anyhow, so now we know that there's such a thing as an EKG that needs to be done, or that has to be done. Cardiac markers, hey, what are my cardiac markers, doc? Am I okay? Did I have a heart attack? And 3, chest x-ray must be done. Must be done. If you're having chest pain and you didn't get a chest x-ray, something's not right. It must be done because what if you did have a heart attack and your chest, this is actually not a normal chest x-ray. I know you guys aren't familiar with looking at chest x-rays, and that's okay. But I put it up there as an example nonetheless. It shows a heart, and this right here is the lung, the right lung, and this is the left lung. It's like looking at a person like this. And the right lung should be nice and black, like this color. But do you see a lot of white fuzzy stuff around it? Yeah. Okay? That is fluid that is being accumulated in the lungs after a heart attack happened. Because after a heart attack, your heart, instead of pumping nice and hard, it starts to go slow. Hey, I don't have strength anymore. I just had a heart attack. One of my muscles is dying. One of the muscles of the heart is dying. So it's not pumping fast enough. So what happens? You start accumulating fluid, blood in the lungs. You see this white out? So these are some basic things that we do to diagnose a heart attack. They're actually very, very effective. They're very good. The correct term is they're very sensitive. They're very sensitive to diagnosing a heart attack. An EKG, cardiac markers, and a chest x-ray. So we have a heart attack. Hey, doc, how are my cardiac markers? Did my chest x-ray look good? That EKG looks good, right? You ask all those questions. And if it doesn't look good, what do you mean? Am I having angina? Remember we learned about angina earlier? Or am I having a full-blown heart attack? Remember, angina is not a heart attack. Angina is just chest pain because of decreased blood flow. So that's what you're going to ask. Is that EKG showing angina? Is that EKG showing a heart attack? What is it? Or is it just indigestion, really? Because I had too many tamales, you know? Okay. So I'm going to talk about some other things that are used nowadays to diagnose chest pain. I'm bringing these slides up because, again, I want you to be familiar with terms like atherosclerosis, angina, cardiac markers, EKG, chest x-ray. Now let's talk about stress test. Everybody's heard of a stress test. There's several types of stress tests. There's an exercise stress test. There's a chemical stress test. There's a nuclear stress test. So confusing. But at the end of the day, they do the same thing. Let's read a little. Exercise stress test. As you see this man on a treadmill, connected with electrodes to a computer that's producing an EKG. Now an EKG shows what? It can show a heart attack, it can show angina, it can show something. So an exercise stress test is for those people who can exercise, like walking at the mall, you know?
So they put them on a treadmill. It determines the cause of the chest pain or the angina. It also helps determine your safe level of exercise. How much can you exercise before you start having angina? Before you start having symptoms of a heart attack? How much? And this is an exercise stress test. They put you on a treadmill, they connect, they hook you up, and they make you walk, they make you jog even, until that heart pumps, 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 pumps. It gets tired, and then it'll start showing on an EKG, hey, there's a problem whenever his heart is pumping this much. That means this person cannot exercise this much, because then he can have a heart attack. And if he's and you know what? This person is not exercising that much and he's already showing symptoms of a heart attack. We should probably take him to surgery or take him and do something to clear that clotted vessel or clogged vessel. So that's what an exercise stress test is. Okay, we have chemical stress test. Same exact thing, but we use certain medications to stress the heart and make it go fast. But this chemical stress test is for those people who cannot walk fast or run or jog. So what they do is that they lie them down. We give them a medicine through the vein. And it causes the heart to go from 70 to 90 to 110 to 140. And we keep pumping medication until we see a change on the EKG. And if we see a change on the EKG, then you know what? This man probably has atherosclerosis. Or this man with metabolic syndrome, remember? Big waist, high cholesterol, high sugar levels.
So that chemical test does the same thing as the other one?
As the other one.
All right.
So there's exercise stress test and there's chemical stress test. You can get either or. It just depends how much you can exercise. If you can't exercise, you'll probably get a chemical stress test. Okay, we're almost done, guys. Almost there.
Test. Can you be used as a preventative type of test?
Correct.
Okay. So
Yeah.
Once every 5 years?
Um,
Starting at 50 or something like that?
let's say we have a patient who suffers from metabolic syndrome, and you know this patient has done his best to exercise and to decrease that waistline, to decrease the cholesterol, to decrease the glucose, to increase his good cholesterol. Let's say this patient has done all of those things. And after 3 years, the patient is still in metabolic syndrome, is still with all these problems. And the patient tells you, I get tired easily. It's probably not a bad idea to do a stress test on these patients, just to make sure that they're not going to have a heart attack soon, because although they're trying, they might have bad genes, remember? Mom and dad gave them those genes that no matter what you do in life, you're still going to accumulate atherosclerosis or a plaque. Okay? Now, some doctors might even give you a nuclear stress test. What is a nuclear stress test? Same exact thing. They stress the heart, but they give you a special substance. It's actually a radioactive substance known as thallium. While they're stressing the heart, they inject you with thallium. And then while they're stressing the heart, the thallium is in your system, and it's a radioactive substance. So if you take a picture of it, you can see the heart muscle. You see this heart muscle? I don't know if you guys in the back can see it, but this is a person who got a thallium nuclear stress test. They made the heart go 150 per minute. And it's going fast, and it's requiring a lot of oxygen and nutrients, but the heart lights up nicely.
completely full of blood, and it's all this is the heart muscle. The heart muscle is full of blood, meaning that there's probably not a blockage. But if there's a blockage, as in this picture, I don't know if you guys can see it, the heart muscle lights up, and then there's nothing here. It's a gray area. And then it lights up nice and red. That's because the thallium is reaching heart muscle in certain areas, but not in others because there's a blockage right there. That means that that person, you know, is having bad atherosclerotic disease, bad blockage of blood vessels by cholesterol plaques. And you all with me? All right. So now we know about exercise, stress test, chemical, nuclear, and just to recap on stress test, what does it do? It measures blood flow to your heart muscle at rest and during stress. It gives us an idea on how badly those arteries are blocked. If someone had a heart attack, it gives us an idea how bad the heart attack was. It can give us an idea what is causing the chest pain or angina. And also lets us know, remember, how much can this person exercise before they have symptoms of chest pain or before that heart can give out. So that's what these stress tests do, to recap. Now we know there's exercise, chemical, and nuclear, which takes pictures. That's all it does of the affected areas of the heart. So remember, I put this slide up because if any of you guys end up having a stress test, whether it's exercise or chemical or nuclear, and you experience any of these things while you're in the stress test, remember to tell the nurse or the doctor, hey, I'm not feeling well, I'm having nausea. You know, I feel a palpitation like an irregular heartbeat. I have some weird sensation on my jaw. If you're going to have a stress test, remember to tell someone, hey, I'm having symptoms. Something's wrong. Don't try and be tough about it. Okay? We know the treatment involves lifestyle changes. You know, smoking, you got to stop it. Blood pressure management, diet, exercise, meds, stress management. And I put this one up there, these two, because I think it's important. If you're ever diagnosed with a heart attack, it's always, always important to have some family or friends around. And don't be tough. Don't try and act as if it's nothing. It's okay to talk about it and let them know, you know what? I hate this. I hate having a heart attack. This does not make me happy. Am I going to die in 2 weeks because I had a heart attack? Am I going to die tomorrow? Am I going to be here to see my grandkids graduate from high school or college? So it's good to surround yourself with people who care about you, or a friend or somebody. Okay? Not a bad idea to plan for the future too, if you had a heart attack. Okay? Whatever it is, plan, 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 whether it's good planning or bad planning, whether it's a vacation to Europe or it's planning, you know, wherever you're going to rest in peace.
You plan for everything.
You plan for everything.
Except that.
Well, let your kids worry about it. Okay, some of the medications that we use, I'm gonna fly through these so we can go home and rest. And the reason I'm gonna fly through them is because, and if you all have any questions, please feel free. They might be a little too detailed. We were talking about warfarin and aspirin. Is it the same thing? It's actually not. Yes, they, we don't use the correct term, doctors. We say that aspirin is a blood thinner. We say warfarin is a blood thinner. But truly, the only blood thinner out there is
warfarin and heparin. Warfarin and Lovenox, which is the same thing as heparin. What aspirin, Plavix, and Effient do, which is what most people get nowadays for angina or a heart attack, are antiplatelets, anti-clot medication. They help prevent the formation of clots. And remember the slide that we had a while ago? Remember that this is an atherosclerosis plaque. And if it breaks, it forms a clot. And how do we stop that clot? With medications like aspirin, Plavix, or Effient. Warfarin does not do that. Yeah, warfarin does not do that. So that's why aspirin, Plavix, or Effient are important.
I've never heard of those terms.
See, that's why I kind of wanted to fly through them. We stop plaques. We stop further formation of plaques with statins. That's your Lipitor. You know, that's your Zocor, your Crestor, all those meds. We stop high blood pressure with diuretics. Everybody's heard of water pills, maybe. Something known as ACE inhibitors, beta blockers, calcium channel blockers. This is just things so you can, at least you've heard of this. How do you reduce the symptoms of angina or chest pain? There's stuff out there that we give to patients known as nitrates. Now, nitrates help relax the blood vessels. And by helping a blood vessel relax, it helps the heart relax. And by helping the heart relax, it requires less oxygen and thus less chest pain.
Makes sense.
So if you give them a nitrate, the heart relaxes. It doesn't pump as hard. It requires less oxygen and thus produces less chest pain or predisposes you less to a heart attack.
But when you're running and so forth, and you're excited, don't you need more oxygen?
Yeah, but when you're running and if you get chest pain or you're excited about whatever thing it is and you're having some real chest pain and you think, you know what, I better go to the ER. And I didn't take my aspirin today. I'm going to pop an 81 milligram or a 325 and I'm still having this chest pain. And my doctor told me that anytime I had chest pain, I could do a nitrate under my tongue because that's usually how they prescribe them. You can pop a nitrate under there and that'll relax the heart. And because at that point, when you're having chest pain, your heart is requiring a lot of food, a lot of oxygen. And if you relax it right away with some nitrates, you give it a break. And you slow down the process the process of it going into a heart attack. I hope I explained myself. Now, if you come in with a true heart attack to the ER, this happens almost every day, believe it or not. Every day someone gets a cardiac cath. Remember what we said? That every minute a woman in the US basically has a heart attack? Every minute. That's a lot of women.
You mean to tell me that every day here in the hospital that people come to get those stents?
Yes, sir. Several times a day. Several times a day. I've seen up to 10 people a day.
On welfare, probably.
Well, I won't go into that. I won't go into that.
You don't want to attack the fellow.
No, let's not do that. Okay. Cardiac cath, guys, also known as a heart cath. Cardiac cath is the same thing as a heart cath. What is it? They basically put a plastic tube. It goes through the leg, goes through the arm. It reaches the heart. And once it reaches the heart, the cardiologist searches for that blood vessel that has that atherosclerotic plaque. that's causing the occlusion because there's a clot. So there's a cardiologist, you know, and he's looking and he's looking and he's looking until he finds that artery that's blocked. And that tube at the end has a stent. And this is a stent. This is a finger, so you can get a perspective of how big these stents are. And that's a stent. The cardiologist finds it, finds that plaque. As you can see, there's reduced space in this artery. There's a balloon at the end of that plastic tube that opens up. When it opens up that stent, and that stent stays open. As you can see, so the flow can be good through that obstruction. So as you can see, the plaque was never taken out. You can never remove plaques. The plaque is still there. All they did was open the artery up. And that has saved people's lives for years. People have had stents for 10, 15 years and no more problems.
It remains there.
And it remains there. And the reason they have no more problems is because they stick to their medications. They stick to a good exercise, a good diet, you know, less stress. And that's what a cardiac cath is, and that's what you'll get if you suffer a heart attack.